struck me is the tears and the sweat. And so for someone who has been working day in and day out on this vaccine effort in the last year, and then really to come out of it with two vaccines that have emergency use authorization under the FDA, and to see so much vaccine hesitancy, not just with everyone, but particularly in the communities that I care about the most, has been part of the reason why I'm losing sleep at night these days, but also something that I feel like is beyond overdue. I think that the vocalness of our communities in this moment really does allow us to hold some accountability from the medical institutional side to show up for our communities, to be transparent about the data and the science that went into these vaccines. And so that's essentially why I am here today. And if anyone has any questions about the vaccine or anything else, really, I'm happy to answer.
What populations are you targeting first, seniors or others?
So the vaccine distribution is being rolled out with advice from the CDC. And with that advice, first, the vaccine is being distributed to people who are in healthcare systems and frontline workers, and then to seniors above. Many of the states are now starting to roll out to seniors above 75, people with comorbidities, etc. And so as the vaccine rolls out, as the distribution starts to hit those target populations, then as more data is accrued, the general population will be opened up on a state-by-state basis, depending on what is allowed in that state to get the vaccine.
Can you please identify yourself so we know who you are? Thank you.
John Garcia with ABC7. Where do you think the hesitancy is rooted? And I know this is part of the effort to overcome that. Any other thoughts that you could share about that?
So I think, one of the things that I think I need to step back and say is that I didn't wake up with this mission, which I think that a lot of times it comes off that way. When I was at the University of Maryland, Baltimore County, I was wholly invested in health disparities, with combining that with my scientific research. So I double majored in biology and sociology, and I took to the streets of Baltimore to understand health disparities in Baltimore City. And so I understand that health disparities are not news to us, right? They are just being highlighted during this COVID pandemic, and unfortunately being highlighted a little bit too late. And so with that, the hesitancy comes from multiple directions. The first of being, there has been centuries of medical injustice on communities, Black and brown communities, that no one can deny, and that it is now time for us to own up to, number one, apologize for, number two, and then secondly, provide an end to those communities to receive equitable health care and vaccines like we are trying to do today. And then secondly is misinformation. So one of the reasons why I'm here today is to serve as a liaison to what is real behind the vaccine and the science and the data that has come from the vaccine. And then thirdly, right, I don't really think that actually I know for a fact. So I've been in vaccine development since I was 18 years old. As nerdy as that is to say, I started working at the NIH as an intern when I was 19, and since then have been in some way doing research towards vaccine development. So what I understand from a scientific perspective, the general public does not, and it is not the general public's fault. And so misinformation comes with, hesitancy comes with misinformation, but also lack of information, because many times there have not been anyone like myself who has been able to break down the scientific information to communities like this. And so with all of those things bringing together, I think that hopefully as time progresses, and I know we're not going to get over the hump of vaccine hesitancy in this one instance, but hopefully as time progresses, we can start to rebuild some of that trust and start to really open those lines of communications from the scientific perspective back to the communities, so that we can get the ball rolling and start to save lives for COVID and for other diseases with that being said.
Naima Latif, On Air Magazine. What efforts are being put forth to get the vaccine to the incarcerated community?
Again, unfortunately for me, when we started this with this effort, and I got a lot of distribution questions, one of the things that I said is I'm very happy that my job was easy in just designing the vaccine and developing the vaccine, because distributing the vaccine is not in the hands of the team for which I lead at the National Institutes of Health. The recommendations for distributing the vaccine actually are now coming from a state-by-state level. So on a very individualized state level, the efforts to get the vaccine to incarcerated communities or otherwise communities are beyond me. But from my understanding that many states are taking it upon themselves to really try to, at least in some of the later stage phases of roll out the vaccine to incarcerated communities and to guards and otherwise in the prisons that